Good evening, everyone. This is Meera from Part 3 Summit, and we have Sumi with us. This week, we are on to the oncology module, and the tasks that we are going to discuss have been the previous recalls which we have had. And these tasks are very important in the way in which you approach them, and also in the communication aspect. Most often, these tasks are where you have to tell the BBN how your body language is, how your way of giving this information to the role player is going to be scrutinized by the lay examiner, and the applied clinical knowledge of what you had prepared in your Part 2 examination, how you are applying it to the patient's management is going to be scored by the expert examiner. And this task is also going to deal with a lot of MDT, the oncologist, oncosurgeon, the clinical nurse specialist, the support groups, Macmillan nurse, GP. So a lot of people also come together, and this is also highlighted in this module. So without much ado, I will be sharing the task. Dr. Zaid, if you are fine, I'll proceed. Yes?
Yes, ma'am.
And before that, I would like to tell you that these tasks are how usually the exam tasks are portrayed, okay, in terms of the content. So I would like to give a heads up on that, because don't be overwhelmed by the number of pages or the amount of material that is given in your 2-minute reading time. As candidates, as clinicians, you should be able to peruse in a fast way the information which has been given out to you. So I remember for me, especially, I had this RPL task where 3 rows of papers were pasted in the cubicle outside just the cubicle. So you need to practice to quickly scrutinize whatever information is given in a fast manner, right? So make sure that is there in your preparation. So with that, let us go. Here's your task, dear. Your time starts now.
Next slide.
You have one more?
Yes, ma'am. 1 minute.
Okay.
Sure.
Final HP report. That's your time, dear. You can start.
Hello, I'm Dr. Zeb, one of the doctor in the clinic. May I confirm your name and age, please?
Second. Okay. Yeah, I'm Eleanor and I'm 65.
How can I address you?
You can call me Eleanor.
Eleanor, I have gathered from your notes that you have gone some surgery for your problem. So before going to discuss your report, can I ask you a few questions so we can make a better your management plan?
Yeah, doctor.
Can you more tell me about your problem in your own words, that what happened and why you have gone to this major surgery? What was the actual problem?
Doctor, actually what happened was 3 months ago, I had bleeding, after my period stopped. And then I went to the GP. Then they did some MRI. They said I have this cancer of the womb. They said it's stage 1A. And they said we just have to remove the tubes and the womb as well as the ovaries. So this was done around 4 weeks ago. And everything was fine. I was recovering well as well, but then suddenly they told me that the report it has been changed to 1B, and some molecular testing was also done, and they said it's some kind of an aggressive cancer. And now they're telling me I need to go for this this radiotherapy, chemotherapy. Why, doctor? I don't understand what's happening. I just want to know my answers.
Oh, I can understand your situation, and I'm so sorry that you have gone to a major surgery, and this now report has been a little bit concerning. Secondly, how your was recovery after your surgery? Is there any complication after surgery, or otherwise you're fine?
I was fine. I'm fine.
Okay. Can you more tell me that after this recovery, are you having any symptoms, any bleeding, or any discharge from downward?
No, I'm fine.
You're fine. Any history of fever, weight loss, or any bowel problem?
No.
Okay. And can you more tell me that do you have any medical condition like diabetes?
I have this hypertension and some amount of knee pain. They told me I have osteoarthritis.
Okay. And apart from this surgery, have you gone through any another surgery?
No.
Okay. Is there any family history of concern, like any history of cancers in your family?
No, doctor.
Okay. And may I know your blood group?
It's positive. What are you going to do with my blood group, doctor?
Just I wanted to confirm it because as they have planned any right radiochemic, so we should confirm that your HB level should be at the normal site. That's why I wanted to confirm it. That okay. And may I know your BMI?
That's normal.
Okay. Don't mind me to ask me that do you have any do you smoke?
No, doctor. Doctor, I came
And
here for reports, doctor. I want to know what are my reports. What are you going to do? What are you going to do with my smoking?
yes, I'm coming to that. I know that it's very difficult for you that we are meeting in these circumstances. I'm so sorry. Are you alone at this moment, or do you want to be accompanied by someone?
No, I'm fine. It's okay.
Okay, you're here. Do you want to be accompanied by my nurse? Because I
No.
have to discuss your report. Miss Eleanor, as that I have confirmed your name, age, and NHS number, and this reports belong to you. As previously, the doctor has told you that the disease process is in early stage 1. But when the surgery was performed, this after this surgery, because this was sent to the tissue microbiology, where the tissue microbiology shows that this report actually is a little bit the stage is higher as compared to the what was expected on MRI. Are you with me so far? Secondly, it's meaning that it has spread beyond the womb. Sorry.
I want to know why this changed, doctor. Why should this happen? You mean the surgery was not done well, or something else? Has the
No.
surgeon qualified? I just want to know.
Yes, I coming to that. Actually, when the MRI is done, actually MRI is one of the specialized technique which shows us about the disease progress. But the MRI has some limitations which does not show the microscopic involvement of the cancer cells. So actually, when your womb was removed, the surgery was performed. This whole of the tissue was sent for the histopathology, under the which was examined under the microscope. In that examination, it proved that there is a stage rather than stage 1A, it is stage 1B, which has spread beyond your lining of the womb. I'll give you so far. Secondly, there are certain molecular testing is performed on your histopathology, which shows that this tumor is actually it's the cancer of the lining of the womb, but it gives certain changes in a genetic form, which is in the form of P53 and the MMRD. Are with me so far? These actually genetic molecules are used for the prognosis of the disease and the recurrence of the disease.
Okay,
So,
okay, I get it. Okay.
So that's why this histopathology shows that ideally, if the disease is in initial stages, it does not require any adjuvant chemo or radiotherapy. But in your case, because this molecular tissue shows that these are positive and there's a mutation in these molecular genes, so you may need the certain drugs in a form of chemotherapy, and some may form you need a radiotherapy. So in order to prevent the recurrence of disease, are you getting so far?
Yeah, doctor. That means my children will also be affected.
At the moment, I cannot comment on this, but I will assure you that your care will be taken under the team of the doctors, where my consultant and the cancer specialist and the the oncologist surgeon and the radiologist team and the microbiologist will you and your reports will be discussed over there, and then your management plan will be made over there after doing certain investigations and after review of your history and examination and on the basis of investigations. Are you with me so far?
Yes, doctor. Yes. So now, what is the chance that I will get cured? I'm so worried I'm going to die, doctor. Here you told me the stage has increased, and you're telling me there's some molecular testing. It keeps increasing. I'm so worried I'm going to die, doctor.
I can feel your situation. I'm so sorry that you are in a distress condition, but I will connect you some support groups. Secondly, at this moment, I want to reassure you that by advancement in the recent techniques, actually the life expectancy has been increased, and secondly, the prognosis of the survival is increased. So we are here to help you and support you, and we will try our best to prevent the recurrence of the disease and improve the chances of survival. And secondly, I want to reassure you that this disease is still in its early stages. So the survival rate is success rate is almost, it's in the range of almost 70 to 90%. And with the advancement in the treatment, majority of the patients like your condition, they do survive and they have a healthy life. And secondly, I would like to tell you that you should take a healthy diet, healthy exercise, and take a change of your little bit lifestyle, and definitely the MTT, whatever the MTT will decide, it will be better. There are certain complications of this chemotherapy and radiotherapy, but they are in the form of, it could be the mild complications in a form a little bit nausea, vomiting, and even the ulceration or soreness of skin. Sometimes
Time's up.
Like continue. So, madam, you said me that there's sexual health reproduction module will be discussed today. I came to know that this is oncology.
Oh, I see. See, dear, we actually informed this about what module we are going to take up at the start of the week itself. And whatever discussion happens in the group is on that particular module only. So it's better you be in touch with the group. And today morning also, I'm sure I gave you a heads up that this is oncology. Anyway, see, you handled it well. Tell me.
I came to know about it.
No, I believe I was messaging you in the morning. You asked me whether it was oncology. Whatever be, see, you handled it well. Now tell me your this one feedback, your reflection.
Ma'am, I did very bad because I even did not take the full history.
No, that's fine. You took all the important ones.
And you took even more than important also.
Yeah.
Okay. Let Sumi give the lay examiner feedback initially, and I'll take up.
Yes, sir.
Yeah, overall, I felt reassured. I felt comfortable, and also the way you had counseled, it was fine. I didn't feel like, oh my God, the stage has increased, but these people are not talking properly to me. They're not explaining well to me. No, I didn't feel like that. I felt good. It was good. Only just that I wanted to ask a few more questions. See, the thing is, you are repeating the same thing again and again, so you're not giving me that chance to ask also. Just a few more questions. I wanted to know about the side effects, and I wanted to take care of my grandchildren if that is possible. Just a few. Otherwise, you covered. You did address all my concerns. The way you addressed was also very good. When I told you that am I going to die, you did not tell like yes or no. You told like the chances of survival are better. So that is also very well done, dear. Though you think you have, since you just think that you have not prepared, that's it. Otherwise, you did handle it very well. Just related to history taking, you asked some of the questions that were not necessary because she's already had a surgery and everything. You just have to explain to her about the reports and the further management. So some of the histories are not important. All that Meera will be telling to you. And you used a jargon called mutation. Otherwise, your explanation was also very good. And you are not very sure whether I needed a genetic testing, isn't it? So that also Meera will be covering it for you. And one thing that you used is 70 to 90%. Better not use percentages. Otherwise, I felt it was good. Just that some of the concerns were not. I didn't have the time to ask you. Otherwise, it's fine. It's okay. I felt good. I felt heard. I felt that you addressed my concerns. Only thing, you need to be a little more confident and speak a little faster, and also make sure that you do not repeat the same things again and again, and give some time for the role player to ask questions, because this is a communication task. Okay, you're only going to tell everything, like the role player will ask you and you're going to tell, so you need to give a lot of time for the role player also to talk. That's it. So over to Meera.
Okay, Dr. Zaib, you were all right to start with. Initially, when you started, you were trying to group yourself, and by the time around 5 minutes or so, you started explaining what exactly was going on. You handled it well, and towards the end, certain things came up to you, and you tried to finish it off earlier. Try to cover points which you did mention in the initial stages. So the starting, opening, addressing the recovery was all right. A little bit of planning was not there, so you were prolonging at that point, and the details about medical illnesses, any drugs, surgery, all those things, you can just one question and move on. You need not be giving a lot of time there. Family history, again, every question was a little bit longer than it should be. You need to be very precise using very short sentences to save your time here. Of course, family history is important, but be very specific of what you are going to ask. You happen to have any family history of cancers in the womb, ovary, or in the colon, breast? Just mention it and move on. Okay. And blood group, again, it was not very relevant. You have her operative details, you have the details with her, and right now it's only going to be chemo and radio. So at this point, blood group is not very relevant. And even though the role player asked you, you still wanted to give a long explanation that took you around 40 seconds of time. And BMI, smoking, all those are fine, but again, it should not be this long. And your starting point, whether you assess the starting point rightly, it was also fine because the role player at the start, she gave you the whole information chunk. Sometimes your job would be to give the information that this is something which we did not anticipate, and this is found to be an aggressive type of cancer. You would need to be giving this bad news and you would need to be taking it up. So assess the starting point, what she has been told so far, what was told to you, where the details of what will be done informed to you, what she knows so far. You need to assess it clearly so that you can build upon whatever information she already has. Okay, so there you hesitated a little bit about again detailing the whole information. So when the role player already knew these things, you can build it up. You need not go back to confirming the name and the details and then detailing it all over again from the start. Okay, so once you have assessed certain points that she already knew, you can say that yes, this happens to be that this testing is done especially for this idea, and this has come out to be whatever you are going to say. So this framework you can use. All right.
Yes, ma'am.
So from then onwards, you mentioned about the adjuvant treatment. There you used a little bit of jargons. The adjuvant, mutation, okay, those things are jargons. And further investigations you mentioned, colleagues you rightly mentioned, and the questions, the concerns that the role player had regarding going to whether she's going to die, and what about her children, those things you tried to justify it. And coming to the final ending part, there you wanted to finish it off by adding on to the adverse effects of chemo radio, but there the time ran out. Yes. So now this will be the key. Okay. This is a task which is looking at how you deal with giving the information for a cancer survivor. Okay, regarding whatever is the further steps going to be and what is the decision by the MDT, whether she is willing to go ahead with that and what are all her thoughts about it. So this is emotional. This is also packed with clinical information, which you need to be putting to her and also address her concerns and queries. Apart from that, communicate with the colleagues, document, and do the necessary further steps without delay. Okay, so that's what it's going to be. Now start with introduction. Give her a rapport building by saying how you have been so far. Sorry to be meeting you under such circumstances, difficult circumstances. How is your recovery? So group yourselves and take a reassuring tone and be the doctor that the patient wants to see following a major surgery for cancer. And the next 1 minute should be what do you know so far? What were you told and how the surgery went on, and what further tests were done? What do you know about that? So from that, what is her idea? What is her concern? What is your worst fear? What do you think is the worst problem that she imagines? Okay, so this gives you about the information about the ideas, concerns, what are all her expectations. Okay, so here the role player mentioned she already knew that there's some issues with the molecular report. It says it's aggressive. So this is her worst fear, right? So with that, I do understand you're anxious. We will discuss about what further needs to be done and why this was done. And I have some questions to know more about you, and then we will come together and discuss the further care of plan. And with that, you can move on to the next steps. So when the role player doesn't know why she is here to know about the results, the final results following the major surgery. If that is the case, you give an initial warning shot that whatever you have, the report is not what you expected. There is the reports seem to be concerning. Okay, this is an initial warning shot. This is not a major BBN. You need not follow all the steps of the BBN, just that the reports have shown to be concerning. We will discuss about this. Now you explain the results. The stage has seen to be, previously we thought with the MRI report that it was confined only to the inner half of the womb, the muscles of the womb. But following the surgery, this has found to be larger, more advanced than we previously thought with the imaging. This can happen with the imaging results. right? MRI might not be 100% sure in telling us how exactly the disease process is. This is the final report which tells us with surety what exactly is happening inside the womb, which is why this seems to be like this, right? And the next thing that we do is the molecular testing. Now, the molecular testing is something which is done, which is looking at the cell biology, how the cell is functioning. And we see the nature of a protein called P53 that shows the presence of a problem in the P53 protein. Implies that if there is a problem, there is going to be an aggressive form of tumor. We generally test that. Unfortunately, this has found to be an aggressive form of tumor which you have. Generally, we do this testing to make sure that people with this kind of problem receive further treatment, because these tumors tend to come back. Okay, so this why is important to be mentioned. So why the molecular testing is done, to make sure that whether additional treatment is needed, because certain aggressive form of cancers can come back. Okay, so which is why you need to mention why this molecular testing was done and what has been found in this cancer, in this HP report and the molecular testing report. Okay. Yes. Clear so far?
Yes, sir.
So you start with the HP report, you go to the molecular testing report and come to the MTT recommendation. So because the aggressive form of cancer can come back, we are going to offer, the MTT has mentioned that they are going to offer this chemotherapy and radiotherapy. Now explain about whatever is chemotherapy and radiotherapy and the initial steps before starting the management steps. Usually this point is forgotten, the investigations, the blood strength and the liver and kidneys, how these organ functions, all those things are usually missed. You rightly mentioned that was well done. And the next steps will be, we will be starting with this. Okay, so that will be for the next 1 minute. And she will have certain concerns. You try to address that for the next minute and invite doubts and document and mention about the clinical nurse specialist will be coordinating with her and get it written and give a written information in her hand and follow it up. Now, regarding the concern whether her family history is involved, like family is at risk of getting a cancer, you can mention that because this is found to be P53 and not MMRD, right? So there you don't have that risk of this being a Lynch syndrome. So MMRD is the pointer which is going to tell you whether this is a Lynch type of tumor, okay, tumor which occurs in Lynch syndrome people. Okay, so because it is only P53, the Lynch is not a possibility here. I do understand your concern. However, we have already tested your molecular type, which rules out that this is not a type of tumor which is running in the family. Okay. Okay.
Yes, sir. Actually, I was not sure. That's why I was unable to reply this question.
Yeah. You are right. Like you did not make a mistake by saying yes or no. You rightly sent it over to the MTT when you were not aware. That is all right. But if you had mentioned this is not at risk, your applied knowledge pointer will be in a better stance, right? So one more thing is, this is one more thing is, here you can see this is P53 abnormal, the mutant type, right? And whenever you see the P53 in early cancers, you have to upstage it to 2C. Okay, so you have to mention it that she has 2C. Whenever we see this abnormality, it is upstaged to 2C because these cancers behave aggressively and they tend to come back, which is why this is staged as 2C, and which is why the MDT has recommended that you would need the adjuvant treatment in the form of additional chemotherapy and radiotherapy. Okay, so this also needs to be mentioned. Okay. Coming to the domains for the station, you will have to start with her post-operative recovery, assessing her understanding so far. What is her worst fear right now? What about her support? Okay, her well-being right now. Mental status, most important, and arrange for the further investigations because she is going to undergo a further treatment. Now, communication with the patients, you need to be empathetic. You need to assess the starting point and use jargon-free language. And before you mention the report, if she doesn't know about the report, give a warning shot and then explain it in simple language. When you are using some terminologies which are like jargons, immediately attach with the explanation. What we do, we call it the molecular testing. We do testing for a protein called the P53. It's a type of marker which tells us how the cell biology is. When it is mutated, that is when it is abnormal, it means that it is aggressive. Okay, make it as simple as possible and check and chunk. Okay, you initially give the information and chunk it and then check whether she is able to understand. This you did well. You did not give a lot of information at one point. You used this very well and reassures that the surgery was successful. So this point also you mentioned, it's not like that. I'll come to that. Generally, what we see is in the MRI, it's not 100% assured that whatever is there, it's being shown in the picture. Only when we do the surgery, we'll be able to understand. When we look it under the microscope and see how the cell is behaving by doing some molecular testing, we will understand how the tumor is, which we did. Okay, so this you mentioned it rightly. And further on, for the applied knowledge, explain that MRI can underestimate the invasion and histology is the gold standard. This is going to be the one which we are going to depend on, and molecular testing is going to tell you how the prognosis is, like you rightly mentioned this. And you reassured also that it is an early stage disease. Other things are negative. This is a very valid point. Usually what candidates do is they will mention only the abnormality and they will say that this is aggressive and move on. But you reassured her rightly that it is an early stage disease, but because of the molecular testing, we have identified that this is aggressive form of tumor, which is why treating you right now is going to be beneficial for you. So it's not all bad. This way you mentioned it very beautifully. Coming to the further points, you justified why chemo and the radiotherapy are to be given, and a little bit of explanation for chemotherapy, radiotherapy is essential. Yes, Dr. Fatima, we will upload it. How the chemotherapy and radiotherapy works and what are all the side effects expected and how you will deal with it. Make sure you practice it because this can be used for any of the BB and station cancers. And patient safety, about the benefits and risks of treatment, why this is going to be given. This will reduce the risk of the cancer coming back. Instead of recurrence, you can mention this. Cancer coming back is better because sometimes role players said to ask whatever is recurrence. Okay, so the risks of treatment. Mentions infection and neutropenic sepsis advice. This is for stations where you talk about the chemotherapy in detail. You need to mention these points. Provide the safety netting. Give the number. Okay, give the contact number and attach them with the clinical nurse specialist. Whatever doubts further they have, they can coordinate. The CNS can coordinate with her and the support group. You mention the name of the support group and give written information about what is going to be the further management and document it and mention the red flags, what she needs to watch out for. Okay, communication with colleagues, you rightly address the whole thing, whoever is in the the loop. Okay, so this is one of the most important things, the continuity of care, that she will be on follow-up. You will be on follow-up, and this will be, I'll be documenting our discussion and your willingness to go forward with the further treatment, and we will arrange it as soon as possible. CNS will coordinate with you. I'll attach you with the Macmillan support group. And I know all this had been overwhelming. We will be connecting you with the counselors also, any further information you would want to know about. So this way, finish with a question. Okay. Okay. Clear so far?
Yes, ma'am. Yes, ma'am.
So that's it about today's discussion. Thank you, everyone. Any further doubts,
Thank
we
you
should
so
take
much,
up
ma'am.
now.